feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show on this Tuesday, and thank you so much for choosing to start the day off with us. Now, this past week we observed Stroke Week in South Africa, and on average 10 people in South Africa suffer a stroke every single hour. So, and a shocking statistic indeed that we need to, of course, use to focus our attention on our topic today with Dr. Darren Green. We're talking about strokes, trying to understand them, especially after you attended a conference this weekend.
A big one, yes, in Josie. It was the annual stroke conference called the Angels Initiative, hosted by Bringer Ingelheim. But it was a massive event with all the top role players, doctors, nurses, emergency personnel involved with stroke care in our country. And what's so special about it, we had people from the government sector, state hospitals, private sector, all the private sector, the big names and the big hospitals, and then obviously some visiting people from overseas. So that was absolutely amazing. Good lineup of speakers, some current trends, etc.
Very cool. Yeah, your social media was lit. I was just watching everything that was going down. But Dr. Darren Green, let's talk about strokes this morning. For anybody who's not really aware about what it is, what exactly is a stroke?
Yeah, so a stroke is a brain attack. Like we get a heart attack, when oxygen is compromised and blood supply is compromised to any part of the brain, you can develop a stroke. And a stroke basically is the process that happens in the brain cells and the brain tissue itself when there's a lack of delivery of oxygen and nutrients to that area. Those cells are cellularly changed and damaged, and whether that damage can be reversed or not depends on how long it takes to restore blood supply to that area.
All right, so let's talk about the difference quickly between the symptoms of a stroke happening to you and a heart attack happening.
Good. So a heart attack obviously normally starts with a bit of shortness of breath and chest pain, whereas a stroke, the easiest way to remember it is the FAST phrase, F-A-S-T, facial asymmetry, so the face can droop and become weak. The A is for the arm weakness. The S can be slurred speech. And then the T is a time constraint. Hurry, 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 because you can reverse the symptoms if you get them to a unit as soon as possible, you know, for emergency stroke care and assessment.
Is it possible to have a stroke and not knowing that you are having a stroke? And what are the different types of strokes that you can get?
100%. So depending on which part of the brain's oxygen is compromised, that's the symptom you would present with. If the back part of the brain, the occipital area, is compromised, you might have visual symptoms only and no arm and leg weakness, for example. So it is dependent on which blood vessel and which area of the brain is being compromised, and that's how you then obviously treat accordingly.
Yeah, and what about a mini stroke? What is that?
Yes, people use that word a lot. It often refers to a transient or a passing stroke, a TIA, a transient ischemic attack. Now, all the word ischemia means is a lack of oxygen delivery, which happens when a vessel becomes partially blocked or temporarily blocked. So that's normally caused by things like a atheromatous plaque, cholesterol plaque or whatever, breaking off in one of the big vessels in the neck, going up. The plaque, whether it's hard or soft, will then disintegrate after blocking a vessel in the brain after a while, and then blood flow is restored within a time period, leaving you with no residual symptoms of a weakness or stroke symptoms, you know, after 24 hours.
All right, well, we're going to keep our lines open, 0214309881. We'll be back again with Dr. Green to understand the risk factors for a stroke.
It's my feel-good breakfast show.
Right, we're back again with Dr. Darren Green, and yes, wow, the facts that he's revealing to us right now. Today's medical chat is all around strokes, because last week we observed National Stroke Week here in South Africa, and of course we'll keep our lines open on 0214309881.
Now, the question that got me wowed was the fact that can a stroke happen to anyone at any age?
It can indeed, and what people don't even know is you can actually have a stroke intrauterine. An unborn baby can have a stroke in the uterus. And what people don't know is that obviously even newborns and young children can develop strokes. Certainly the entity of young strokes is a very specialized entity, and often the cause has to be investigated thoroughly so as to prevent future events, to know what contributed to it in the first place. And if you think about it, what a stroke actually is, either the blood vessel gets blocked, you know, or by a clot, or the blood vessel ruptures and you have a bleed in the brain. So different causes, from aneurysms and weaknesses in the wall of the blood vessel, allowing obviously when pressure builds up to leak, or the clot itself. Now different things can give you clots. Obviously the thickness of the blood is determined by your hydration status, about the proteins that make up the cells in the blood, whether you have too many certain cell types, etc. So protein C and S deficiency. People on estrogen therapy and oral contraceptives to develop thrombuses are at a higher risk, for example. And then, of course, you get inflammatory conditions of the blood vessels called vasculitis, inflammation of the blood vessels, where the inner lining becomes like sticky Velcro. And then, obviously, the different components of blood and scar tissue, whatever, can sit there and cause obstruction.
Yeah.
So young strokes are a real entity.
Yeah. Let's talk about the risk factors associated with a higher chance of getting a stroke. I'm looking at that picture already.
Yes.
I'm thinking, is it one of those things, once again, is it like lifestyle?
Diet, cholesterol,
all
obviously,
of
is what
things.
that's getting at. So
very accurate picture.
dyslipidemia, so the wrong ratios of your good and bad fats, obviously, can add to it and lead to atherosclerosis, which is obviously lipids lining the blood vessels, making the space narrower and narrower so that the blood can't pass through. Then, obviously, right at the top, a risk of a previous stroke puts you at risk as well. People that have had a previous stroke have a much higher incidence of a recurrent stroke. A TIA that I mentioned, a mini stroke or a passing stroke, puts you at risk. The highest risk of actually developing a full-blown stroke is within 13 days or 10 days of the initial presentation. So it needs to be worked up and checked out completely. Atrial fibrillation, irregular heartbeat, can lead to clots forming in the heart. When the heart is asynchronously contracting, you can have a clot that breaks up and showers a myriad of small emboli throughout the system into the brain. And then, of course, smoking, lack of exercise, obesity. Those are the big ones that all play a massive role in stroke.
All right. Wow. Well, we're going to keep our lines open once again, 0214309881, especially a bit later on wanting to find out exactly what initiatives were planned from the stroke conference that you attended. So stay tuned and engage in our conversation.
It's my feel-good breakfast show.
A very warm welcome back to your Feel Good Breakfast Show, Expresso on SABC 3.
Exactly. We are talking about strokes, of course, after having observed Stroke Week last week, and we are here with Dr. Darren Green. Dr. Darren Green, we've covered a lot so far, but I want to know about a heavy stroke. For anybody who's had a really heavy stroke, what is the time of recovery and what is it going to take to recover well?
Most frequently asked question, how long will it take me to return to normal? Can I return to my former glory?
Yeah.
And the reality is, people are under the impression that the level of rehab that they actually recover within 6 months or a year is the level at which it's going to stay for the rest of their lives. What I can tell you is that in practice, that's not true. In practice, we see continuous improvement and regaining of function years down the line, up to 10 years down the line in many, many cases. So depending on which part of the brain's been destroyed or wiped out, and also depending on a lot of prognostic features, your age, your lifestyle, your diet, your willpower, obviously, to get going and actually train new pathways. Remember, the brain is connected with complex highways of hard wiring. In other words, the more you practice something, the more actual hard structure actually forms for that pathway to become more evident and easy. So that's what we need to know, and with people that are dedicated to the process of improving, they can improve things up to a long time. And then the surrounding areas can actually take over some of the function that was lost. So the cells around the damaged area of the brain can develop and actually adapt to regaining some of the function that you've lost by that original area in a process called neuroplasticity.
Wow, the human body is a wonderful thing indeed. We've got a caller on the line right now, Estelle from Bloemfontein. Good morning, Estelle.
Hi, good morning, Doctor. How are you?
Dr. Green is ready to take your question.
Good morning, team. I do like to watch you every day, and I do love Dr. Green so much.
Thank you.
Getting some love.
Thank you.
Dr. Green, a big question to you. My daughter is 29 years now. She's been suffering from epileptic attacks since she was about 3 months old. She's not a smoker, she's not a drinker. The doctors in Bloemfontein can't keep her on the right medication. Is there any relative line to heart diseases?
All right, so I think if I'm understanding correctly, the relation between the epileptic attacks that she's been having and I think possible stroke or heart disease.
So
does she have to be concerned about that?
And certainly epilepsy from that age, from the age of 3 months, I think she said, hey, is something that one needs to look at. You do get childhood syndromes of epilepsy that children grow out of as they move into teenage years. Others carry on into adulthood, and the prognosis of epilepsy obviously is dependent on many things. It's depending on where the focus of abnormal signal arises in the brain and that kind of thing as well. It also depends on the treatment plan and so forth. And what the structural components of the brain actually look like as to the cause of the epilepsy. Remembering that epilepsy affects primarily, obviously, the outer shell of the brain, the cortex, and the communications through what's called the corpus callosum, which connects the 2 hemispheres of the brain. Okay. So that's quite important. So for her, obviously, sure, people can develop seizures after a stroke, depending on which part of the brain is affected. You know, with stroke, there is a connection to seizures, sometimes, not always. And with heart disease, certainly, if the heart is a pump supplying oxygen to the brain, and that pump is defective or has a period where not enough oxygen gets to the brain, you can have then damage or scarring and parts of the brain that are more sensitive to a lack of oxygen that actually then are damaged. Even at birth, that can happen. I'm not saying that's what happened in this case. So yes, there is a link between seizures and heart disease, and certainly a link between seizures and stroke, as we've explained.
All right. Well, thank you very much for that call.
Thank
we
you
hope
for
that was a helpful insight from Dr. Darren Green. But as always, do consult your medical professional as well. We'll have one more little chat with Dr. Green here after. Do keep calling us on 0214309881.
It's my feel-good breakfast show.
All right, we're back again with Dr. Darren Green for our final conversation engagement about strokes. And I wanted to talk about neuroplasticity, Dr. Green, because you
sounds like a big
referred to
word,
that.
eh?
It sounds very fancy.
Plasticity. So that involves, obviously, the brain's ability to actually regain function where function was lost. So that happens in 2 ways. There's a process called neurogenesis, where genesis involves new cells being produced. Those processes are controlled by hormones and chemical substances in the brain. Your brain can actually make new brain cells throughout your life. But the process that drives it, those hormones are controlled again by lots of lifestyle factors. And one of them is interval training, for example. You can increase the level of your brain-derived growth factors by doing interval training, and that regenerates new brain cells to the areas that have been damaged. And the plasticity, as I mentioned, is the ability to take on new function and assist in areas and domains that has been lost.
All right.
For anybody that's watching right now and maybe wanting tips, what lifestyle changes can all of us make to try and reduce the risk of having a stroke?
You don't know what you have until you've lost it. And what we need to do is speak to people that have lost it to understand and motivate ourselves. So obviously, obesity is a massive risk. So we need to all take ownership of managing our own bodies and weight. What we put in terms of fuel is important because of the association with dyslipidemias. The choice to smoke or not smoke is massive. We're seeing, that it's associated with so much increased risk of cancer and various cancers right now. It doubles your risk of developing many cancers. So smoking, and then obviously hypertension. Blood pressure is a silent killer. If you don't know what your blood pressure is, have it checked regularly, because pressure in the system can lead to the blood vessels changing in structure and even bursting, and that leads to stroke as well.
Let's take a caller right now. On the line, Gertrude from Tembisa. Good morning, Gertrude.
Morning, how are you?
Very well, thank you. Thank you for your call. What is your question?
Oh, my question is that I was just diagnosed with this stroke, and the doctor said I had a young stroke. So now what I'm experiencing is this sharp pain on my neck and my headache. So when that pain strikes, I can't move my head correctly. So I just want to know how severe or how badly this headache can affect my recovery.
All right. So there are conditions that mimic stroke, and one of them is like a hemiplegic migraine. So you get a migraine and a headache that makes you actually have symptoms on one side of your face, arm, or leg, or your body that can last a few hours, and when the headache resolves, all those symptoms then disappear. So that's one thing to consider. But with the neck pain and things like that, you must remember there's so many things that contribute to neck pain, from the muscles to the vertebral alignment, the arteries and the blood vessels in the neck and so forth. If this is a persistent problem, it could be caused by postural things, sleeping, your pillow, your picking up your baby, that kind of thing as well. So you'd have to go and look at very systematically. And certainly if it's something that's causing debilitation, in other words, you can't fulfill your tasks every day, and the frequency is getting worse, she needs to seek help from a medical practitioner.
Yeah. All right. I wanted to talk quickly early on about the initiatives that have been discussed or that were discussed at the conference. Can you summarize those for us quickly?
Yes, I think the movement is quite exciting. It's promoting awareness around emergency stroke care, but also stroke care in general, even after someone's had a stroke. It's about educating the public on the warning signs of stroke, that FAST protocol that I mentioned, and then getting them to a centre as soon as possible for the best chance of survival, outcome and reversal of those symptoms. So this Angels initiative is quite amazing. They're aiming to have 165 hospitals in South Africa geared and ready to handle emergency situations in stroke. That's both in the public sector and in the private sector by the end of 2019. So that's what it's about, committing people to that.
Excellent. Well, thank you so much, Dr. Darren Green. And if you'd like more information on what we discussed today with Dr. Green, you can go to our website, expressoshow.com. Dr. Darren, good call.
Thank you. Thank you.